Good afternoon. Thank you for hanging in here. This is the penultima, they say, the second to the last session. So I really want to thank you for sticking with us. We have a fantastic panel. I am so honored to be here and to join them with such expertise. I want to start the same way Leah started, by thanking Susan Walker. And the whole, give it up for Susan Walker. Right. Who invited me here, and I followed her work and the amazing team in Jamaica's work for a long, long time. So I'm delighted to be here. My name is Joan Lombardi. I've been celebrating my, 54th year in the field of early childhood. And I'm really happy to have a panel that you could say is about how researchers involve policymakers. But I like to think about it the other way around. How does policymakers involve researchers? I want to tell you a little bit about my background before I introduce the panel. I spent the majority of my life in the policy space. I can't say that I'm a policy maker despite the fancy titles I've had, because I always felt like there was a policy maker above me that I had to convince of what I already knew. But be that as it may, either in a policy position or translating research to policymakers. And I use that word translation because really, after the last 2 days, you have to translate what we just heard to them. I think that we've used general terms like policymakers, but who are we talking about? Are we talking about the Ministry of Education, Health? We've mentioned them throughout the conference. I haven't heard about the finance minister, who's so important. I haven't heard very much about policymakers that are at the local level, or the policymakers that today are dealing with the climate crisis, which I think we're feeling in this room, right? So we have to broaden our definition of policymakers. Before I introduce them, I'm going to share 3 lessons that I learned in my years. Number 1, give it to me fast. Tell me the results quickly. And we'll talk more about these themes. But if you've been in the offices of policymakers, they're not very patient often. So you got to give it to them right away or we'll lose them. And I loved Leah's presentation because of that. Secondly, talk common sense and try not to talk in jargon because we'll lose them. You'll lose me, let alone people that know less than me. And then finally, and probably the most important thing that you'll hear from everybody, is tell me what I'm supposed to do Monday morning with your results. Because if you can't answer that question for me as a policymaker, what good is the finding for me as the consumer of the research? So with that, let me introduce this amazing panel. They are really the brain trust of Thrive. That's what I've learned in my short time here. And what's exciting about the panelists is they all have a national perspective. And I think we all know that chimes are changing and that it's the focus at the national level on national policy that's really the goal. I'm going to introduce all 5 of them. First, we're going to hear from Dr. Jena Hamadani from Bangladesh, who is a pediatrician, an international emeritus scientist. I can't really get that, Jena, because I think of you when we met 20-some years ago, who's been doing amazing research for many, many years with ICDDR in Bangladesh. We're then going to hear from Dr. Rebecca Esliker from Sierra Leone, who's the country principal investigator, head of the Department of Mental Health program at the University of Makeni in Sierra Leone. So the contexts are very different here. Third, we'll hear from Ester Elisaria from Tanzania, the chief research scientist with Ifkara Health Institute, and a deputy principal investigator who spent, I should say, 7 years in government. So she's another one of these bridge builders. And then also from Kwabena Tandoh, Dr. Kwabena Tandoh from Ghana, who is a seasoned administrator, and now a researcher, but most recently, the former Deputy Director General at the Ghana Education Service. So again, a bridge builder. And then finally, and I think some of you just heard, Professor Sally Brinkman from Kiribati, who comes the furthest, let's give her a hand, from the University of South Australia, a social epidemiologist who's done amazing work on, and she's going to talk a little bit more about her population measurement and what that means for policy. So with that long introduction, let me first turn it to Jena. You've spent so many years in the field, Jena. You've done so much research on parenting in the health sector and outside of it. What's been your experience getting policymakers involved in what you're doing?
Sorry, the last bit, can you repeat?
Yeah, how have you, what's been your experience and what's worked in getting policymakers involved in your research right from the beginning?
Thank you. I was thinking when you were giving these few suggestions, I wish I knew this beforehand, because when we have worked with the policymakers, we haven't been very successful. Honestly speaking, when I started my research on ECD, it was my PhD project, so all I was interested was about doing my PhD, finishing it, writing my thesis, and completing it. So I wasn't so much into getting in touch with policymakers, but then of course, what we did was initially we talked to the parents. And I believe they are also kind of policymakers, you can say, because if the demand is coming from parents, then the policymakers will have to oblige. And I think it was very interesting that throughout the time that we have gone, we have worked with Ministry of Health, we have worked with Ministry of Women and Children Affairs. And whenever we try to involve them in our projects, we basically didn't get very relevant ideas, because they were not really concerned about research. They wanted to know what's going to happen, or like how people are going to accept this. So after we have done a lot of, small-scale projects, then only we were able to convince the policymakers to work with the government, and we included the ECD programs in the government system. I wouldn't say we are there yet. We have gone a long way, but we still have a long way, maybe a longer way to go to get the policymakers. But I think two approaches, bottom-up and top-down approaches, both are important to create demand and supply. So the demand from the public is important, but also we have been, to some extent, we have been able to convince the policymakers that this is needed. One problem, I think you heard in the morning also from my colleague, that in Bangladesh, the policymakers keep changing. And it's very difficult to keep up with the changes. But I think we have been successful in a way that to get them on board. Whenever a new person came, we have been able to contact and get them.
Interesting that when you first started your research, you weren't thinking about policymakers. When I came to the conference, I was going to count how many times we said policy, thinking they wouldn't be saying it, but they were saying it right from the beginning. So something's changing. I'm hoping that you wouldn't be someone in a PhD program now that didn't have a course on policy, let alone know it. So that's a positive. I'm going to turn to Esther. You've spent a lot of time in research, and you've spent a lot of time as a policymaker. What have you learned?
Oh my God, I have learned a lot. Yes, it's true. I've been in the research for 15 years, and I've been into the implementation for 5 years, and also I've been into the policy for almost 7 years. So what I have learned is that engaging policymakers is something that is really important, but the timing of their engagement is crucial. So the question here is, are you engaging them at the beginning of your research as part of the designing of the research questions, or are you engaging them at the end when you are disseminating the findings? So for the Thrive, I think this is a learning for me, and for the Thrive, I have been in the research for almost 15 years, but Thrive told me something different. For all other research, I was seeing that researchers are coming with a predefined idea. And you are going into the field, you collect data, and you want to inform policymakers on your finding, and you want the buy-in. But for the Thrive, the perspective was slightly different. The policymakers were engaged right away from the conceptualization of research questions. And the critical issue is that was those research questions answering their key agenda? Because they have their agenda, like for the cash transfer and parenting program, the government had a question. They wanted to know what are the effective interventions that can be implemented in Tanzania in a lower cost. That was the question. So the other thing was how they can integrate them within the existing infrastructures like health facilities. So if you are implementing something that is within the government request, you are expecting a higher buy-in, but also the scaling up is also something that can come up directly because they are the one who have proposed it. The same applies like when we were doing the ECD model, we also observed that the concept of ECD models did not come from us as researchers. It actually came from them. They wanted, because they were struggling about these ECD centers, they were not registered. These daycare centers, many of them were not registered. So they wanted to know what is the problem, why are they not registered? So they wanted an answer, you say quick answer, like why are they not registered? So that is so critical because now when we are doing this research about the ECD centers establishment, we are responding to the government need. So we went into doing the deeper analysis like why are they not registered? What are the key gaps in terms of the guidelines existing? Because they have already the guidelines existing in place. So we wanted to look into critically, and we came up with a very critical analysis showing that it's the way they presented the guideline and the content, like the infrastructure, the way they have to, the curriculum delivery, the human resources available was not scalable, was not possible even for the facility to implement. And this really helped us now to co-design with the government, not us as researchers, but co-design with the government. And they have been involved right away from them conceptualizing the idea, now to the co-designing and to the implementation. And as we are speaking now they have hired someone to even start drawing the structures and helping also with the registration processes. So that is the critical things I've observed during the implementation of Thrive, but also from my research work.
Yeah, such an important point, right? So you're responding to what the government needs are. And I mean, it goes both ways. I think the problem is we live in two different time zones because the policymakers want it right away and research takes time. And so that's part of the challenge. Rebecca, you live in a very different climate, very different context. You've had different experiences as a researcher. Tell us about what you've learned in Sierra Leone.
As you are well known, Sierra Leone is a small country and is heavily donor-driven economy. Resources are limited. Personnel for doing research is almost non-existent. It's very limited. So we have very limited research programs going on in Sierra Leone, and most of the research program going on in Sierra Leone is from donors. It's from donors sponsoring those research programs. And for me, for example, in my area, it's my specialization is mental health. And I was the first person in Sierra Leone to open up a department for psychology in the whole of the country, because Sierra Leone has gone so many traumatic events and nobody has ever addressed the issue of the trauma that people went through, a civil war, and then Ebola, then COVID, then now we have a big pandemic question on substance abuse we call KUSH, and then now we are also struggling with the monkeypox. So we don't have the resources to say with the government to do research on these areas. So when I came to Sierra Leone and I established the Department of Psychology, we started getting in projects from international bodies to address some of these issues, to get some data on mental causes for mental health, especially in children, in adolescents. And we started producing some data. We included the different departments from the government, like Ministry of Health and Sanitation, the Ministry of Education, and the Ministry of Social Welfare and Children. And we will include them from the inception of the project. We will go visit them in their offices, because they will not come to us unless we go visit them. We'll explain to them the purpose of our projects. And then as the project goes rolled out, we will give them updates of what is happening, the information that we're getting. And we formed a local advisory group wherein we brought in all these policy makers from the Ministry of Health, from the Ministry of Education, from the Ministry of Social Workers, and from the different sectors in the community, in the local community, like the chiefs, the traditional healers. We brought them all into this consortium. We brought in the police, school children, and all of them serve as advisory to the project. So whatever they will give us inputs of when we give them an update of where we are going with the project, they will give us an input. They will say, no, do this here, do this there, and do this there. And that's how we've been involving with the policy makers. And at dissemination, we will also do conferences wherein we will invite all policymakers, and then we will invite the local community to give them the dissemination and the findings of our projects. So this is how I've been doing research in Sierra Leone. Maybe they have some different experiences. I know Thrive is there, and I also give Thrive. I train the researchers, the RAs, and they work together with some of the projects in Thrive, and also for Boston College. They also work with Boston College, and this is how we've been working and trying to make policy changes in Sierra Leone. But as you know, resources are limited, and it's a donor-driven economy. So it's very difficult to get anything concrete from the government itself. And actually, I would say we give them the results, we give them the findings of our research, and then they will say, okay, it's fine, we agree with you. Does that reflect in their policy? I doubt. Maybe it might reflect in some policies, but then what about the implementation side of it? How do I know they're implementing it? Because I don't get feedback. They will probably put it in a cupboard and let it rust there for a while before they. I mean, that's not because if I don't get feedback from them, I don't get questions from them. That is telling me that, my friend, we have your work. We've seen what you've done, but thank you very much. We keep it for you.
But at least you're talking to each other, and you're interacting with them, and you've got an advisory committee.
Yes.
So this is progress.
Yes.
This is progress.
Yes.
Thank you so
You're welcome.
much. Let me move to Ghana. And 4 months now you've been out of government?
Yes.
How's the transition?
Well, it has actually been a very interesting and exciting transition. I spent about 6.5 years in government in actually not policy making, but an intersect between policy making and policy implementation. And in the environment in Ghana, we have the setup in such a way that we have the ministries that are more of the policy making arm, working with the cabinet and parliament to make policies. And then we have, most of the ministries have implementing agencies. So within Ghana, we have the Ministry of Education, then we have the Ghana Education Service. And that's where I worked. Now, the transition has been quite interesting because I came from academia and then went into private sector work and then eventually found myself in policy implementation at the government level. Now, it is quite exciting because transitioning back into the research environment, I am beginning to have a clearer understanding of where the gaps lie. One of the things that the research space tend to forget is that no battle plan survives enemy contact. You know, and so research comes with very rigid A, B, and C are the things that we want to do. But then you're going to work with a policy maker or a policy implementer. Now that policy maker or that policy implementer mostly are politically elected. They have a 4-year lifespan. Every 4 years, they are coming back to make sure that they are surviving. And so their mindset in the policy making space as well as the policy implementation space is, what can I do to make sure that I survive the next 4 years? You know, and so when you come with the thing that we've been talking about here a whole lot, RCTs, it doesn't make sense to the policymaker. Because the policymaker is looking for, what exactly can I do that would buy me the most votes, that will make the most impact to the people out there? So what we need to be able to understand in terms of the research space is to make a decision that, or to understand that in the mind of the policymaker, everything they are doing is 80% politics and 20% implementation and the research. So how do you make sure that your 20% that you are bringing in really supports their 80%? And that is where you need to be able to understand their needs so that you are better able to figure out the research that you must do. I understand that in the research space, we want to be able to publish, and for that matter, we pick certain topics that are publishable, if that's even a word, you know, so that when we finish, we get something that we're able to publish. But I'll just give you a quick example. While I was Deputy Director General, Thrive, I was working with Thrive, so it's quite interesting that I'm now on this side of the table. But when I was working with Thrive, I had a couple of interactions with, at the time, still the country manager for Thrive in Ghana. And in one particular conversation, she kept asking me, what keeps you up at night as a Deputy Director General? And what I told her is that what keeps me up at night, especially in the ECD space, is the fact that when I recruit good teachers, or teachers that I believe are good, and I place them in schools, they don't last. Because in Ghana, there is this mindset that KG education is on the lower end of the professional ladder. And so anybody that goes into KG education wants to leave. So what I wanted to understand as a policy implementer to make quick gains is what motivate those that stay in longer. And based on that, we were able to then formulate a research question and a strategy so that it will answer the questions that are lingering for me. Rather than, you know, researchers come to me and say, we have money, we want to do A, we want to do B and C. The next thing is for researchers to understand that the most impact you would have is when you co-create. And so, you know, you need to be able to say, okay, I have resources. These are the things I want to do. And even if you want to be able to do those particular things, at least at the very beginning, as Esther said, go to that policy implementer and then work with them. You know, I'm going to use a relationship example, but my sister is married to a gentleman here in the UK, and they have these conversations, and whenever I speak to him, he always tells me that, KB, I make 100% of the decisions, but your sister believes that she makes the decisions. Because whatever I think about, I would take it to her and say, what do you think? And then she would repeat it back to me, and then we'll move forward, right? So as a researcher, you know, if you are able to then go straight to that policymaker, and then, or that policy implementer, and then work with them right from the ground up, you get so much more cooperation. You are able to get a lot more support. You know, when I was working at the GES side, because I was very involved in co-creation and in the early stages, you know, when letters come to my desk for approval to go into the field, oh, I already know this project. Rather than a letter will come to my desk and I'll say, who are these people? Call them for me. And my next meeting time may be another 6 weeks before I have time. So I think it is important, the lessons that I would say I have learned that I can share with you is, one, understand that the policymaker you're working with has an expiration date. And so you need to work within that expiration date. 2, go to that policymaker right at the very beginning and co-create with them. And 3, let your research question answer a problem that they are facing. And I think that there'll be a lot more smooth.
Wise advice. Such wise advice from all of them. I mean, what's on your mind? Like go have coffee, a tea, and say what's on your mind. That's the hint. Well, Sally, I'm going to move us all the way back to the Pacific. And I know you presented on one measure earlier today, but you've been doing really interesting work at the population level. And I know the results have been mixed from the policymaker view. Can you tell us a little bit about that story?
Sure. So much of the research that I do in the Pacific is what we call population measurement, but many people think of population measurement as a survey of the population. So a statistical sample, for example.
Michael.
Sorry. Whereas most of the work that I do is census-based, so we try and do the entire population of children given a certain age. In the Pacific, this is working really well. We have measured pretty much every child in Kiribati anyway for aged 3 through to 5. And we geographically map that data back to communities. So communities get the results, and we have, in the Pacific, there's a very strong sense of what we call reciprocity. So if you do research on us as a community, we want to know what the results are. We want to be able to engage, right? And that works really well for us in terms of the political sense as well, because that's where the mobilisation starts. Kiribati is also quite interesting in that the community, we would call it a council. In Kiribati it's called a manieba. There's a representative from that community in the manieba is actually represented in Parliament. So there's a direct line of sight between the community and Parliament. So by presenting data back to those communities and talking about what we can do for early child development, what sort of supports there are, so we present the results back. Generally, they'll be doing well on one aspect of development, maybe not so well on another aspect of development. So we can still take a strength-based approach to the community mobilisation as well, saying, well, you know, you're doing all right on, say, physical health and development, but not so well on these aspects. Why might that be? And you can generate the conversation. At the same time, we work at the cabinet level and with the ministries. We have long-term trusted relationships, been working there for a very long time, and the advantage of countries with small populations is you get to know the important people pretty quickly, and you're able to then go through that process of creating a trusting relationship with that reciprocity and loyalty to each other. So, it takes time, and you've got to dedicate that time to it. But we're getting fantastic engagement by the policymakers, writing cabinet papers, engaging with ministers. Ministries are presenting the data themselves at other events. So it's not just us as researchers presenting the data, we train the public servants as such so that they're able to then use the data themselves, and then they engage in it more, of course, as well. So they're sort of some of the strategies that we use.
Yeah, it's really, I'm going to come back to you, Sally, about what happens when you do population measurement and you don't see change. And you're a policy person and you've instituted what you think is an early childhood policy, and the population's not moving. How do you respond to that? So I'm going to come back to you on that. But I want to go back a second to Esther. You talked to me earlier in the day about one example where you designed the research with the policymaker, but then you stepped back from them when you were doing the RCT. Can you talk a little bit about when is it appropriate and when is it not appropriate to have them so involved? Because there's a difference.
Yeah, thank you so much. I think that's a very valid question. Definitely the study design you're doing determine how much the policy makers should be involved. Let me start with the RCT we had. So the Kizazi Kijacho, the Next Generation Project, where we were testing the parenting and unconditional cash transfer. So this was an RCT. So the designing part, like the conceptualization of questions, the research question came from the government. And they were also part of the designing of the indicators, and they were also part of the protocol development. They were part of the trainings. And the lower level, council level, they were also part of the quarterly supervision. But with the RCTs, at the time the implementation starts, the level of engagement might also affect the results. So there's that period during the implementation phase where you need minimum interaction. Because if you are intensifying, let's say, supervision or visit by the government to the intervention site, that might also alter the effect you are going to see at the end of the day, and you have a biased estimate. So during that period of time, you find there is that period where you cannot engage much of the policymakers into the process. And for them, actually, that is a very frustrating period because they are like, why is they not engaging us anymore? So, but definitely when you are coming into the point of getting the results, you're also going to engage them more. So that period of time, I think, is just, we can communicate with them what is going on. Of course, they have to be informed. But as you mentioned earlier, policymakers need quick questions, need quick answers to the questions. So when the RCTs are taking forever to be finished, like 3, 4, 5 years, and they cannot answer their short-term plan, it's becoming frustrating. And I think this is the strength with the Thrive because they combine the short-term research work and the long-term. So this short-term research actually are informing, like when you are doing the analysis of the system, like whether the system is ready to uptake the project, you are informing them about the system. You might also do the process evaluation, informing them about the acceptability. So this part of small projects are quite important because they're actually informing two things. They're informing them in terms of the processes and what is going on, but they're also informing them the scalability in the later stage. So this combining the short-term and the longer-term interventions are actually very necessary. And that has to come right away from the designing and to the process of follow-up. But this was quite different when we are doing now the ECD center model, because this is now the co-designing my colleague was talking about, where this is not an RCT, which is more controlled. So this is a situation where now the policymakers are engaged into the co-designing, like when we are developing the curriculum, what is required? if we want to know the numbers of the teachers and in relation to the ratio of the students, how much are they required? So this is a two-way process. So we ask this question, they give us the feedback. So how much this should be implemented in terms of, is it a full time, is it a short time, is it, how many hours should be delivered? So all these things need a two-way, it's a more structured engagement process, and all of them also participating into the decision process, but also proposing the way forward. So I saw a completely different between when you are implementing an RCT, which is very long, and when you are implementing something that is a shorter term, but also that it's like you are developing a model which is more engaging in a two-way relationship throughout the process.
So it's not simple. And I mean, I think we have to understand these nuances, because our tendency as researchers are, I can't have you too close to me because I'm afraid you'll manipulate what I want to do, especially if you're paying for it, right? So it's this dance that I think we're doing and we're still learning about. So Jena, you were shaking your head the whole time. Rebecca was saying, did you have similar experiences?
Yes, it has been really challenging for us, and I should warn everybody here, it's not really easy, as Esther was also saying. It's really difficult to get through, especially with the political system that we have, and also with the change in the policymakers every time. But where we have been successful, well, before that, let me say another thing. I always give the example of immunization. And I think in most countries there is this expanded program of immunization. We call it EPI, that WHO has started. And like in Bangladesh, we are very successful with immunization. We have something like 97, 98% full immunization for children. But I am sure when it was started, it wasn't that successful. So one thing that we have found is very, very effective if we take the policymakers to see the program in person. Like we give them the data, we show them pictures, we show them graphs. That's not really working as much as if they come in person and see. And so far, whichever policymakers we have been able to take with us to the field to see the process that is going on, they have been quite convinced, and they have been like full of praises and very important. So my advice would be have patience, be resilient, and don't give up.
Yeah, no, great advice. And I think bringing them to the community, that's where they thrive, I think. You have a very different context. You're working often in conflict-affected areas. You named many different pandemic-like conditions that you're facing. What's working for you in Sierra Leone?
That's a good question and a very difficult question to answer. We're trying, to raise awareness, do advocacy, educate people, mainly on what is mental health and what is mental disorders, how these different events, tragic events, have really impacted the community, have impacted their thinking, their behavior, especially for the younger children. And especially Boston College will be attestation to this. They've worked with, for the past 22 years, they worked in Sierra Leone collecting data on these war-affected children. And now they're working on how the impact of the war on these young adults now that are parents, how has it in fact affected their parenting skills? And we're doing also interventions with these group of individuals we're working with, and we are helping to develop capacity building for professionals. So because in Sierra Leone, because of the fact that we don't have any specific, say, mental health program, which is just developing now, because for the fact that we have so many other NGOs, both international and national NGOs, now focusing more on the addressing the mental issue in the country because of so many tragic event that has happened. And I think we are making a little bit of impact. But then, as you say, now there's the political will to address early childhood development programs, and the present government has mandated that all public schools should have a preschool. Are they funding this? I'm not sure. Are they of quality? I doubt. But anyway, the mandate is there. And these are some of the little things that we're starting to address issues, because when the child is in a very healthy environment, the child grows healthy. But then there is this political aspect that also comes into this, political turnovers. And when this government is showing interest in this area, and their term is maybe 4 or 5 years, and when the next government comes, as you correctly say, they're all changes. Or changing of personnel. I think it's happened to Boston College. When we want to do this project for Thrive, we use the first piloting, we use the community health workers. But then the Minister of Education suggested, why don't we use the preschool teachers for this particular project? He said they're kind of to be the best people to understand the child and to understand their growth, their development growth. And that was accepted. But now we built up that relationship with him for so many years. Now he's the chief minister, he's no longer the Minister of Education. So we have to start like square one again. These are the challenges that we have.
And have you been able to have the health minister and the education minister work together?
That's a challenge when there's always competition.
We try, right?
Yeah, we try.
Right.
Yeah, but the competition
One
is there.
step at a time.
Yes.
I'm going to come back to Dr. Tandoh in a minute, but I want to see if you have an answer, Sally, to this challenge of doing population level data, collecting that data, and then how difficult it is to move child development in that time.
Yeah, so the scenario that we're talking about is we had population measurement in Kiribati that was undertaken back in 2017 with the World Bank funding, and then through Thrive we redid the census data collection, same methodology and everything. And unfortunately, over that time, we have seen child development go backwards and across every single developmental domain. So it's not even that we can say, oh, well, we've done okay in this area, but not others in this. And unfortunately, it's just gone backwards everywhere. And particularly interesting for what I would call the sort of the more formal academic skills, so early literacy, early numeracy, things that governments, particularly through preschool systems, can have actually an influence on. So the results were very disappointing. The government had, in between those two time points, brought in an early child development policy, the first one, so the inaugural policy, and they had invested in supporting salary for ECE teachers as well. So they had actually invested some money in the early childhood space, not so much in health and in the first few years, but some in early childhood education. So the conversation was difficult because they were expecting an improvement. We were able to say, well, COVID did occur, so there, COVID may have had some impact, but of course we couldn't causally say what it was. The strategy that we took, which I think is really important and I have done throughout my career, which means that I'm not a very good academic, is I have always worked in very strong partnership with government to ensure that I do not publish a paper or publish a report and have it on the front page of the newspaper without the government being fully aware, fully prepped and ready and understanding what this is all about, so at least they can have some commentary if it does go public. So in this circumstance, we had the conversations with all of the chief ministers. We had reported it to there's a national research committee that's chaired by the Office of the President. And let's say they were none too pleased about the results and they were not keen on anything going public at all. And we were able to negotiate that we would still talk to the community about their results, but we would just talk to them about their current results. To a certain extent, that's still okay because the messages are still the same, right? Children aren't doing well in these aspects of development, and these are the sorts of things that you can do to try and help support development. The conversation is the same with the community. So we presented the maps, but we have not presented the change data at community level. We have, of course, presented it at cabinet level, and we have a report that has gone to donors and key stakeholders, but it is now public, the report, but we haven't made a show about it. So it's, not hitting any major press stories or anything along those lines. And in that way, we continue to maintain trust with the government, and they continue to see us as a valued partner in helping to support them in their journey for early child development rather than being seen as a threat. And I think that's been, that's super important.
It's a relationship.
Yeah.
Right.
So,
it's just like it's serve and return, only with the policymaker.
exactly, yeah.
Right. What would you do different? What would you do differently in your research after your many years in government? And then I'll open it up.
Well, I guess what I would do differently, and I would go back to the idea that depending on the space you're working in, and for this particular conversation, we are talking about ECD and children. So what I'll do differently is to figure out what exactly are the things in terms of research that I must do to support the children. I think that yesterday, our first plenary, the speaker talked about the fact that if the decisions are made with children in mind, then at the end of the day, we have such the outcome becomes better because you're thinking about the children. So what I'll do differently is to really understand exactly what it is that will support the children. And also really to understand, I think it goes back to when I did my PhD, my first PhD, I wanted to find out, so let me give you, the layout is that I was, at the time, head of department at St. Louis Community College. And in the American system, the community colleges are mainly not a board, they don't have a residential facility. But I noticed that there were lots of West Africans who were attending community college straight from West Africa. And I wanted to understand why. Why are they taking that decision to attend a community college? And so that informed the way I developed my questions and then my hypothesis and how to answer that particular question. I think that if in the work that we are doing as researchers, we first appreciate the phenomena that are happening and appreciate the phenomena within the context in which they are happening, then we would have a better question to ask. Rather than to sit in our ivory towers and conjure things that we think we need to research on. Listen, I may be a little biased, but I'm a qualitative researcher. I'm not a quant person. I'm a qualitative researcher. And so for qualitative research, for me, the key thing is to try to understand the phenomena rather than to, and all of it has such strong, but I think that even for a quant person, if you can spend some time in the space that you want to research and at least observe so that your research will answer questions
Critical.
that or answer or bring you answers for phenomena that are happening. The lit reviews are okay, but a lit review from Australia, you can use the lit review from Australia all you want, but in Ghana it doesn't fit, right? And so if you want to do research in Ghana, at least even if the literature is not there a lot, spend a little bit of time, understand the space. Then all of a sudden, so that's what I would do differently. I would want to understand more exactly what is happening and how to answer that question.
Yeah, very important advice. I mean, the context matters.